and thanks for joining us on Medwatch today. I'm Vanessa Villafuerte. For decades, doctors have searched for a cure for cancer. Now, one treatment is showing real promise for blood cancer patients, and for the first time, it's available right here in the Central Valley. It's helped one local woman become cancer-free, and it could offer hope to others battling cancer. Christine Quintero knew something was seriously wrong when she walked into the emergency room 2 years ago.
I could remember I was in the emergency room for 4 days before they transferred me upstairs to a room. And I could remember when they came to me, and the doctor came to where I was at. And I remember I had a fever and I was really sick. And she told me, "You have cancer."
It was there doctors told her she had an aggressive form of lymphoma, a blood cancer that affects the body's immune system.
I just started thinking all these things like, I'm not going to make it, I'm going to die.
The diagnosis came with limited treatment options and a lot of uncertainty, but her oncology team at Community Cancer Institute did offer one possibility. It's called CAR T-cell therapy, a form of immunotherapy that, for some patients with advanced cancer, has the potential to completely cure the disease.
CAR T can cure about 50% of patients who otherwise do not have any other good options. So it is truly transformative.
The FDA approved the therapy in 2017, and now Christine is the first patient to receive it at Community Cancer Institute, making her the first in the Central Valley.
We're very, very happy because I think Christine is really a great example of a patient who is served well by this treatment. And we're hoping that this is going to be the beginning of so many other patients that we can help. Because this is, as we said, it's revolutionary treatment. It is potentially curative for patients who otherwise don't have cure.
CAR T is a personalized cancer treatment made from a patient's own T cells. T cells are genetically engineered to produce special proteins that help cells attack cancer. Once they're infused back into a patient, these cells target and kill cancerous cells. Dr. Haifaa Abdulhaq and her medical team are the first in the Central Valley to successfully deliver the therapy.
This is a revolutionary treatment, and it has changed lives of so many patients. However, unfortunately, we did not have this available in the Valley, and we had to send a lot of our patients outside to go either to the Bay Area or to Southern California to be able to get it, and that poses a lot of hardship. And many patients are just simply not able to do that.
Data from the National Cancer Institute shows that in CAR T-cell clinical trials involving people with large cell lymphoma, more than 30% didn't have any signs of the disease after 5 years. It's been approved to treat 14 types of blood cancer, but also involves 24/7 monitoring over 30 days.
Once you receive your infusion, you have to stay within 2 hours of your infusion center for 30 days with a caregiver that monitors you for 24 hours a day, 7 days a week for those 30 days. So it's not just you staying away from your home for 30 days, it's you and a loved one. You leave your house, you leave your family, you leave your dog and your kids and your whole entire support system. And that's just not okay for our patients to have to do that.
On June 26th, Christine received good news. Her post-op PET scan showed no signs of cancer in her body. This wouldn't have been a possibility had CAR T therapy not been an option. She says the experience gave her a new perspective, not just on her life, but on the lives around her.